Hi, my name is Danny. I'm a student nurse. I'm in with my patient. I've introduced myself. I've washed my hands with some hand sanitizer. I've verified the correct patient using the armband, asking name and date of birth. I've explained that we're going to be putting in an IV today, and we're going to be doing it in his hand to give him any potential IV fluids, IV push medications that may be ordered later on. I've explained to just try and relax the best that he can. I may ask him to lower his hand or pump his fist, get that vein nice and pumped up. And then what I'm going to do now is I'm just going to prep my materials. So what I've got here is a 22 gauge 1-inch needle. So I'm just going to make sure that that is opened and ready when we get to that point. Then I'm going to take my flush and I'm going to get rid of the air bubbles. And then from there I got my J-loop, and I want to keep it in the package to ensure that it's the side that connects to the IV port will be aseptic, but I connect to the other side. And I'm going to go ahead and prime that tubing now, and that can just stay in there. And then now that that's primed, I'm also just going to kind of take a quick glance. That does look like the vein that I want to go into, so I'm going to tie this tourniquet about 4 inches above my site. Make sure I get it nice and snug. Alright, so that's on there. So now I'm going to palpate, and that seems like a nice strong vein to get into. So I'm going to take that tourniquet off for now, and I'm going to take my chlorhexidine wipe, and I'm going to scrub for 30 seconds, looking down at my watch to ensure that I do go for a full 30 seconds, just getting it as clean as possible. At this point, I'd also just tell my patient, the process from here, that after this I'll reapply that tourniquet, and I'll get the needle out, and just kind of reassure them that everything's gonna be all right. It'll just be a little prick. All right, and 30 seconds is up. I can discard this. I do need to let this dry for a little bit. So as that's, just wait, talk with the patient for a minute as it's drying. Once it gets close to being completely dry, I'm going to go ahead and reapply this tourniquet. All right, that tourniquet's on, it's nice and tight, able to get like a finger under there. So now I'm going to grab my needle, and it is a 22 gauge 1-inch. And so with this needle, I'm going to make sure that I got my bevel up. I'm going to go ahead and make sure the skin's nice and taut and secure that vein. And I'm going to advance the needle at a 15 to 30 degree angle. I'm going to be looking for blood return. Okay, and I do see blood return. So I'm going to decrease my angle just a little bit. I'm going to advance about 1/4 inch. And then I'm going to advance that catheter okay. And I'm going to release my tourniquet. I'm going to apply pressure. My needle's going to come out and go into my sharps. I am then going to grab my J hook and secure that on there. All right, and then once that J hook is connected. I'm going to aspirate, and I do have some blood return. So then with that flush, I'm going to flush approximately 2 to 3 milliliters of the saline solution of the flush. All right, and at this point, I've got this one-way valve ready. Close it. There we go. All right, and now I'm going to grab my Tegaderm, which disappeared on me. So now I'm gonna get this Tegaderm, I'm gonna open it up and apply that. Should get it nice and tight down there. All right, that Tegaderm nice and tight. I'm also going to take one of my pieces of tape that I prepared. And I'm going to tape that down. And I'm going to use my other piece of tape to tape the J-loop. All right. So now that I have my catheter inserted, it's secured down with tape in the Tegaderm, I take my alcohol swab, and I'm going to clean this port for 15 seconds using friction. Looking at my clock. Okay. And at this point, I would attach any IV fluids that may be ordered already. I would clean up everything. I would ensure my patient's comfort level at this time, ask him how it feels, if it's going to be maybe a little irritating, unpleasant, but it shouldn't be real painful or anything like that. So I just ensure that the patient's doing okay. After I've cleaned up my mess, I'm gonna take my gloves off, wash my hands, and I'm gonna go chart. I'm gonna chart the location, I'm gonna chart the time, I'm gonna chart that I used a 22 gauge 1-inch needle, and then I'm also gonna chart my patient's response and how they did with the IV as well. And that is it.